Are ready for the 10-minute rule motion maternity units requirement for bereavement suite, and I call Rosie Wrighting.
Thank you, Madam Deputy Speaker. I beg to move that leave be given to bring in a bill to require new maternity units to have a bereavement suite and for connected purposes. For anyone who is experiencing the loss of a baby, it is already one of the most difficult times in their life. It's made more difficult when they experience this in a maternity ward in their hospital, surrounded by mothers and families celebrating new life. There is no number of new facilities that can take that pain away. But for parents where the local hospital has a dedicated bereavement suite away from the main labour ward, they can process that pain with privacy and peace. Madam Deputy Speaker, I'm often inspired by my constituents in Kettering. And I am especially proud today to introduce this bill, inspired by the Twinkling Stars appeal, which campaigned for a new maternity bereavement suite at Kettering General Hospital. I want to pay tribute to Northamptonshire Health Charity, who've dedicated so much time and care to this appeal, but also to SAMS, who work to make sure that anyone affected by pregnancy or baby loss get the care and support they need. And I want to recognise the work the NHS is already doing. Day in, day out, staff at Kettering General Hospital help people go through one of the most difficult experiences anyone can imagine. And they continue to do this despite years of underfunding and understaffing. It's a testament to our hospital staff. Finally, I want to thank all the families who've been involved in this campaign, and anyone who's donated, helped out at fundraising events, sold masks during the pandemic to raise money, or even doing skydives. The Rockingham Wing, which is the maternity ward at Kettering General Hospital, is where I was born as a premature baby 8 weeks early. It's where my mum fought for her life after a complicated and traumatic birth, which was made even more difficult as she was surrounded by happy and healthy mothers and their babies. Like for me, there are many people in Kettering whose lives started in the Rockingham Wing. So it was really alarming to hear that in 2023 it was crumbling because of RAC. So I'm pleased to say that the RAC has now been mitigated and a 2-storey extension will be built behind the existing maternity unit to help the team improve the care they deliver each year to about 3,000 families and their babies. This will be particularly important in Northamptonshire, where we have a growing population and lots of new families moving into the area. On a recent visit to Kettering General, I walked the grounds of the new maternity ward. I saw plans for the new bereavement suite, and thanks to the campaign by Northamptonshire Health Charity and the efforts of local people, I saw the place that this will now be built. Before this appeal, families in Kettering who'd lost a baby, either during pregnancy, during birth itself, or through compassionate induction, stayed in a room within the labour suite, where mothers could be close to their babies but not next to them, and where partners walked through the maternity ward to reach them, surrounded by sounds of new life and delighted parents, making a heartbreaking experience even harder. Kettering General cares for up to 100 families a year who lose a baby, who will now be cared for in a suite that has a private bereavement room with ensuite facilities and a cold cot for precious time with their babies. It will have a dedicated family room with a kitchenette, sofa bed, and a peaceful private space for families to gather to support each other, and a quiet office space for bereavement midwives where sensitive conversations can be conducted with care and privacy. At Northampton Hospital, where some of these facilities were already in place, the Daisy Suite appeal aims to create somewhere for follow-up care with specialist bereavement nurses that isn't on the maternity ward. So bereaved parents who have experienced unique trauma, when they return to the hospital, won't have to walk back through that same maternity ward again, which could re-trigger painful memories. A bereavement midwife at Northampton Hospital wrote to me in support of this campaign and said coming to hospital to give birth to a baby who is known to have died or will die is unimaginable. The grief and devastation can never be fully understood as each circumstance is very different. What we can do as a hospital is try our very best not to add to those feelings and make an awful situation even worse by not providing support and an understanding environment. We all want them to feel supported, heard and truly cared for. She explained that her team are currently based in a maternity ward but aren't easily accessible for families to drop in for support and are difficult to find for staff members who are looking for support themselves. A bereavement suite would allow them to see more families, allowed parents to return after discharge and spend more precious time with their babies, and provide a separate space where families are not coming face to face with other pregnant women and newborn babies while going through such a heartbreaking time. These campaigns are based on real-life experiences. The changes being made to our maternity units and hospitals in Northamptonshire are all things families have noticed after experiencing bereavement themselves and who want to make a positive difference for future parents. I can't even begin to express the admiration I have for parents who are taking their pain and channeling it into making things better for those who come after them. Yeah. Some of those parents have contacted me. They've mentioned the importance of quiet care when going through a time like this. And they've told me that every parent going through the worst time of their lives should have the opportunity to receive care in private. Yeah. When I've spoken to Northamptonshire Health Charity, they highlight the importance of hearing families' voices in this conversation and how dedicating time and experience to the campaign can have a healing impact for some of the families who've been involved. It is really important that parent consultation is right at the heart of this bill. This government is building an NHS fit for the future, and a big part of that is listening to service users and taking on board their feedback. I believe this is particularly important in spaces like bereavement suites, where changes that might feel small, like the feel of the space or the access to the room, can make a huge difference to parents and families. In Northamptonshire, bereaved parents have met with nurses and they've walked through the maternity ward, pointing out where changes can be made to better support parents in the future. Currently in the UK, 13 families a day lose their baby before, during or shortly after birth. That is around 4,500 babies a year. So this is bigger than Kettering or Northamptonshire. And when I was researching for this bill and researching bereavement suites, I looked on Just Giving to find it full of appeals from every corner of the country for funding for new facilities, specialist counselling and trained midwives for bereavement services. A collaboration of charities working to support people affected by the death of a baby have developed the National Bereavement Care Pathway to improve the quality and consistency of bereavement care received by parents after pregnancy loss or the death of a baby. As of 2024, every NHS trust in England has now signed up to the National Bereavement Care Pathway, but we know there's still work to do. Not all hospitals are currently able to provide a properly equipped or suitable bereavement room, and some are in the middle of the labour ward or aren't soundproofed. The Twinkling Star Suite at Kettering General Hospital is a perfect example of how when we welcome contributions from families and parents with experience, we spot things we didn't know we needed. But at the moment, it is families, communities and charities who are raising money so that parents can face such a difficult time with a little bit more privacy and comfort. Nobody can take away the pain of losing a baby, but we can make sure that in that pain, families are met with compassion, dignity and privacy. And that begins with a bereavement suite in every newly built maternity ward. Thank you.
The question is that the honourable member have leave to bring in the bill. As many of that opinion say aye? Aye. After contrary, no? The ayes have it, the ayes have it. Who will prepare and bring in the bill?
Jen Craft, John Cooper, Maria Tidwell, Michelle Welsh, Richard Holden, Lee Barron, Charlie Dewhurst, Mike Reeder and myself.
Rosie Wrighting.